So a question I get all the time is, when should I consider a neck lift? When should I consider a facelift? And is there any other option for me if I don't want to have a long recovery or big incisions? So let's start first with the least invasive of all. Topical treatments, tightening procedures, the skin tight on Cyton that we use to tighten up the skin. This is simply a topical machine that passes over the skin several times, and several treatments that we have to get. This is for someone who has very, very little laxity of the skin, and one has to have really realistic expectations of what this is going to cost. Now, there's also other procedures such as Kybella, but they're all very topical. There's microneedling. Again, these are going to produce very subtle results. So if you have very subtle deformities, this is good for you. But the minute you're looking and there's basically ample amount of fat underneath the chin, or there's laxity of skin and the muscle, you may want to consider something more. Now, if you have ample amount of fat, but your skin is pretty plump and is good and is elastic, and you tend to be younger, you would benefit from liposuction and possibly some skin tightening like Renuvion or J-Plasma. Next step would be if you have some fat, or maybe not a lot of fat, but you just have a lot of loosening. You feel underneath your chin and it doesn't feel like there's a lot of fat, but there's just a lot of loose skin. What you have at this point is excess skin and likely loosening of the muscle that we have under our chin called platysma. Then you probably need some type of a neck lift. Now, who needs a facelift and who needs a neck lift? And what is the difference between the two? If, when you look at yourself, you only have isolated loosening of the skin below your neck, you may benefit from just a neck lift. But the minute you have some loosening and you have some smile lines, or there's a little bit of like droopiness to the cheeks, you probably should consider at least something for the mid-face as well with your neck lift. Keep in mind, a facelift is almost 70% to 80% neck lift. So when we do a facelift, about greater part of the attention is actually spent on trying to correct the neck, and then we sort of merge it together with the mid-face, and the mid-face is actually a little bit of the simpler part of that whole procedure. So there's a very low threshold between someone who really needs a neck lift and a facelift, and it has to be picked pretty judiciously by you and also by the person who's counseling you.